Respiratory syncytial virus, or RSV, causes infections of the lungs and respiratory tract. It is common in children, and most have been infected with the virus by age 2. However, this virus can also infect adults. In adults and older healthy children, RSV symptoms are mild and usually mimic the common cold. However, RSV can cause severe infection in some individuals, including babies 12 months and younger, particularly premature infants, older adults, people with heart and lung disease, or anyone who is immunocompromised. Children who attend childcare centers, or who have siblings who attend school, are at a higher risk of exposure to RSV and reinfection. RSV outbreaks tend to occur in fall to the end of spring. An infected person is most contagious during the first week or so after infection. In infants and individuals with weakened immunity, the virus may go on spreading, even after symptoms go away, for up to 4 weeks. Signs and symptoms of respiratory syncytial virus infection most commonly appear about 4 to 6 days after exposure to the virus, and may include congested or runny nose, dry cough, low-grade fever, sore throat, sneezing, and headache. In severe cases, RSV infection can spread to the lower respiratory tract, causing pneumonia or bronchiolitis. Signs and symptoms of severe RSV may include fever, severe cough, wheezing, rapid breathing or difficulty breathing, and bluish color of the skin due to lack of oxygen, that is cyanosis. If germs enter the space behind the eardrum, it can cause middle ear infection, that is otitis media. A link may exist between severe RSV in children and the chance of developing asthma later in life. Once an individual had RSV, there are chances of reinfection even during the same RSV season. Although symptoms usually aren't as severe and are in the form of a common cold. However, they can be serious in older adults or in individuals with chronic heart or lung disease. Most children and adults recover in 1 to 2 weeks, but some might have repeated wheezing. Severe or life-threatening infection that requires a hospital stay may occur in premature infants or in someone who has chronic heart or lung problems. For the reason that RSV and COVID-19 are both types of respiratory viruses, some symptoms of both of them can be similar. Having RSV may lower immunity and increase the risk of getting COVID-19. If these infections occur together, it can worsen the severity of COVID-19 illness. Respiratory syncytial virus Enters the body, through the eyes, nose or mouth, if someone with RSV coughs, or sneezes near you, as it spreads easily, through the air, on infected respiratory droplets. It can also pass to others, through direct contact, such as shaking hands. The virus can live for hours, on hard objects such as countertops, crib rails, and toys. Touching mouth, nose, or eyes after touching a contaminated object increases the chances of picking up the virus. There is no vaccine for respiratory syncytial virus. But lifestyle habits can help prevent the spread of this infection, including washing hands frequently, avoiding exposure by covering mouth and nose while coughing or sneezing, limit babies' contact with people who have fevers or colds, making sure that kitchen and bathroom countertops, doorknobs, and handles are clean, discarding used tissues right away, using separate drinking glasses or disposable cups and labeling each person's cup, avoiding smoking, as babies who are exposed to tobacco smoke have a higher risk of getting RSV and potentially more severe symptoms, and washing toys regularly, particularly when your child or a playmate is sick. The medication Palivizumab, having brand name Synagis, given in the form of a shot or injection, can help protect certain infants and children 2 years old and younger, who are at high risk of serious complications from RSV, including children who were born prematurely, have chronic lung disease, have certain heart defects, or have a weakened immune system. It does not help treat it once symptoms develop. The first injection is given at the start of the RSV season, with monthly injections given during the season. This medication is not recommended for healthy children or for adults. Scientists are working to develop a vaccine to protect against RSV.